1. Review chart for any limitation in physical activity.
Identifying limitation prevents patient discomfort and injury.
Number 2. Bring equipment to the bedside staff.
Bringing everything to the bedside conserves time and energy. Arranging items nearby is convenient, saves time, and avoids unnecessary stretching and twisting of muscle on the part of the nurse.
Number 3. Perform hand hygiene. And put on gloves. And other PPE is indicated.
Hand hygiene and PPE prevent the spread of microorganisms. PPE is required based on transmission precautions.
Number 4. Identify the patient. Discuss procedure to the patient and assist the patient's ability to assist in the bathing process as well as personal hygiene preferences. Hi, good day. I am Nicole, your nurse for today, and I will be assist you in your personal hygiene. Can I see your tag name, please? Leticia San Jose, are you ready, ma'am?
Identifying the patient ensures the right patient receives the intervention and helps prevent errors. Discussion promotes reassurance and provides knowledge about the procedure. Dialogue encourages patient participation and allows for individualized nursing care.
Close the room door. And reduce temperature if necessary.
This ensures the patient's privacy, lessens the risk for loss of body heat during the bath.
Number 6. Remove sequential compression devices and anti-embolism stockings from lower extremities according to agency protocol.
Most manufacturers and agencies recommend removal of these devices before the bath to allow for assessment.
Number 7. Offer patient bedpan or urinal. Do you need a bedpan, ma'am?
Voiding or defecating before the bath lessens the likelihood that the bath will be interrupted because warm bath water may stimulate the urge to void.
Number 8. Remove gloves. And perform hand hygiene.
Hand hygiene deters the spread of microorganisms.
Number 9. Adjust the bed to a comfortable working height, usually elbow height of the caregiver.
Having the bed at the proper height prevents back and muscle strain.
Number 10. Put on gloves. And lower side rails near to you. Assist patient to side of bed where you will work. Have patient lie on his or her back.
Gloves prevent transmission of microorganisms. Having the patient positioned near the nurse and lowering the side rail prevent unnecessary stretching and twisting of the muscle on the part of the nurse. Loosen top covers and remove all except the top sheet. Place bath blanket over patient and then remove top sheet while patient holds the bath blanket in place. If linen is to be reused, fold it over a chair. Place soiled linen in laundry bag. Take care to prevent linen from coming in contact with your clothing. The patient is not exposed unnecessarily and warmth is maintained. If a bath blanket is unavailable, the top sheet may be used in place of the blanket. Remove patient's gown and keep bath blanket in place. If patient has an IV line and is not wearing a gown with snap sleeves, remove gown from other arm first. Lower the IV container and pass gown over the tubing and the container. Rehang the container and check the drip rate. These provide uncluttered access during the bath and maintains warmth of the patient. IV fluid must be maintained at the prescribed rate. Raise side rails and fill basin with a sufficient amount of comfortably warm water. Add a skin cleanser if appropriate. According to manufacturer's directions, change as necessary throughout the bath. Lower side rail closer to you when you return the bedside to begin with the bath. Side rail maintain patient safety. Warm water is comfortable and relaxing for the patient. It also stimulates circulation, provides for more effective cleansing. Put on gloves if necessary. Fold the washcloth like a mitt on your hands so that there are no loose ends. Gloves are necessary if there is a potential contact with blood or blood fluids. Having loose ends of cloth dragged across the patient's skin is uncomfortable. Loose end cool quickly and feel cold to the patient. Lay a towel across patient's chest and on top of bath blanket. This prevents chilling and keeps the bath blanket dry. With no cleanser on the washcloth, wipe one eye from the inner part of the eye, near the nose to the outer part. Rinse or turn the cloth before washing the other eye. Soap is rotating to the eyes. Moving from the inner to the outer aspect of the eye prevents carrying debris toward the nasolacrimal duct. Rinsing or turning the washcloth prevents spreading organisms from one eye to the other. Bath patient's face, neck, and ears. Expose patient's forearm and place towel lengthwise under it. Using firm strokes, wash hand, arm, and axilla, lifting the arm as necessary to access axillary region. Rinse if necessary and dry. Apply appropriate emollient. The towel helps to keep the bed dry. Washing the far side first eliminates contaminating a clean area once it washed. Gentle friction stimulates circulation and muscles and helps remove dirt, oil, and organisms. Long, firm strokes are relaxing and more comfortable than short, uneven strokes. Rinsing is necessary when using some cleansing products. Use of emollient is recommended to restore and maintain skin integrity. Placing the hand in the basin of water is an additional comfort measure for the patient. It facilitates thorough washing of the hands and between the fingers and aids in removing debris from under the skin. Use of emollients is recommended to restore and maintain skin integrity. Repeat actions number 15 and 16 for the arm nearer you. Bath blanket to a patient's umbilical area. Spread a towel across patient's chest. Wash, rinse if necessary, and dry patient's chest. Keep chest covered with towel between the wash and rinse. Pay special attention to the folds of the skin under the breast. Exposing, washing, rinsing, and drying one part of the body at a time avoids unnecessary exposure and chilling. Areas of folds of skin may be source of odor and skin breakdown if not clean and dried properly. Lower bath blanket to the perineal area. Place a towel over a patient's chest. Keeping the bath blanket and towel in place avoids exposure and chilling. Wash, rinse if necessary, and dry abdomen. Carefully inspect and clean umbilical area and any abdominal folds or creases. Skin fold areas may be sources of odor and skin breakdown if not clean and dried properly. Raise side rails and change water and wash clothes. Return bath blanket to original position and expose far leg. Place towel under far leg. Using firm strokes, wash, rinse if necessary, and dry leg from ankle to knee and knee to groin. Apply appropriate emollient. protects linens and prevents the patient from feeling uncomfortable from a damp or wet bed. Washing from ankle to groin with firm strokes promote venous return. Use of emollients is recommended to restore and maintain integrity. Wash, rinse if necessary, and dry the foot. Pay particular attention to the areas between toes. Drying of the feet is important to prevent irritation, possible skin breakdown, and infection. Use of emollient is recommended to restore and maintain skin integrity. Repeat action 24 and 25. Make sure patient is covered with bath blanket. Change water and wash clothes at this point or earlier if necessary. The bath blanket maintains warmth and privacy. Clean, warm, prevents chilling and maintains patient comfort. Assist patient to prone or side-lying position. Put on gloves if not applied earlier. Position bath blanket and towel to expose only the back and buttocks. Positioning the towel and bath blanket protects the patient's privacy and provides warmth. Gloves prevent contact with body fluids. Wash, rinse if necessary, and dry back and buttocks area. Pay particular attention to cleansing between gluteal folds and observe for any redness or skin breakdown in the sacral area. Near the anus may be a source of microorganisms. Prolonged pressure on the sacral area or other bony prominences may compromise circulation and lead to development of decubitus ulcer. If not contraindicated, give patient a back rub. Back massage may be given also after perineal care. A back rub improves circulation to the tissue and is an aid to relaxation. A back rub may be contraindicated in patients with cardiovascular disease or musculoskeletal injuries. Use of emollients is recommended to restore and maintain skin integrity. Skin barriers protect the skin from damage caused by excessive exposure to water and irritants such as urine and feces. Raise the side rail, refill basin with clean water, discard wash clothes and towel. Remove gloves and put on clean gloves. The washcloth, towel, and water are contaminated after washing the patient's gluteal area. Changing to clean supplies decreases the spread of organisms from the anal area to the genitals. Clean perineal area or set patient up so that he or she can complete perineal self-care. If the patient is unable, lower the side rail and complete perineal care, following guidelines in the accompanying skill variation. Apply skin barrier as indicated. Raise side rail, remove gloves, and perform hand hygiene. Guiding perineal self-care may decrease embarrassment for the patient. Effective perineal care reduces odor and decreases the risk for infection through contamination. Skin barriers protect the skin from damage caused by excessive exposure to water and irritants such as urine and feces. Help patient put on a clean gown and assist with the use of other personal toiletries such as deodorant or cosmetics. Protect below with towel and groom patient's hair. Change bed linens as described in skills 7 to 8 and 7 to 9. Dispose of soiled linens according to agency policy. When finished, make sure the patient is comfortable with the side roll up and bed in the lowest position. Proper positioning with raised side rails and proper bed height provides for patient comfort and safety. Remove gloves and any other PPE and perform hand hygiene. Removing PPE properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene prevents the spread of microorganisms.